We're going to be looking at how technology is actually transforming people's life, yes, and how that technology is empowering communities to access better health and demand for more accountability. We're going to be also looking at accountability to affected communities. How does it work? How we do it in places like Bangladesh, in places like Namibia. And I think when looking at game changers, which is the theme of this particular conference, I think the question I would like us to answer today is accountability to local communities a game changer? And if so, how? We have heard about complaint mechanisms. People have actually the right to complain, something that we forget in many occasions. I think the word accountability scares, many of us maybe at many times. When we look at accountability, we look at transparency, we look at monitoring and evaluation, we look at participation, and we look at complaints and feedback mechanisms.
We have got a number of services, but I am interested to actually mention few services actually who are ensuring the accountability. So one such service is called Complaint Suggestion Box. And this is actually a service receivable by SMS. So in Bangladesh, throughout the country, we have got 800 public hospitals. So in the wall of each hospital, we have actually put a signboard. And it describes how to actually send complaints or suggestions for improving the service by SMS. So the patients, their relatives, or the people visiting the hospitals, if they are not satisfied with our service, so they can put an SMS. And these SMS comes to us in a web portal. And our staff sees. So every day, virtually, we are receiving about 1,000 complaints. The complaints are like that. For example, the OPD should start at 9 a.m. But at 11 a.m., the patients are seeing that there are no doctors. Okay? Maybe the doctors or the nurses are behaving actually not well with the patients. The medicine are not in supply. Toilets are not clean. So we receive the complaints, and immediately our staff, so they call the senders of the SMS to understand more about the real situation. And they talk to the local authority to actually have immediate solutions of the problem. So this is one kind of accountability system.
Given that most Kenyans, most Africans, the only and the first way of communicating is via a mobile phone, and given that we're driving penetration so hard, we're now able to give the citizen the tool for demanding performance and for demanding accessibility. Putting our customer care on social media was a bit risky because every time you tweet, everyone else can see it. So everyone else can see the problems that a customer's facing, unlike when you just simply make a phone call. It's then just a one-to-one thing. But we were courageous, and it's helped us. I think that the service that we're delivering has moved tremendously because it's open, because everybody can see that your network is not working, or that you've got problems with M-Pesa, or whatever the problem might be. The fact that it was open and it was open to everybody forced us to deal with it, and I think that the same applies to government agencies.
There are accountability issues at two levels. One is at the provider level, at the village where services are delivered. And second is at our level, where we facilitate the provision, because there are doctors on our panel who are sitting in the big cities, because these doctors don't want to go and live in rural areas. In fact, that is a problem which we are trying to solve. And how do you use technology to connect these doctors with those human elements, the providers who are available at the village level? So there is an accountability issue from our side too. The doctors sitting in Delhi and Patna, some of them connecting from London and Bombay, are able to do what Bob was saying, the telepresence kind of system using the internet, where the patient and the doctor can see each other, and the doctor is able to do blood pressure, measure heart sounds and lung sounds and a variety of other things there, and write a prescription. From our side, the medical consultations that are happening, what the doctors do, there is an audit system. The prescriptions are being audited. Every consultation that takes place is all recorded, and we do a prescription audit as well as a consultation audit. It's a panel of doctors who sit and view this. Currently, we do 100%, but we will move towards a sample system. And this review can happen from anywhere in the world. So if there are retired doctors sitting at home and they want to do something, and they can be given access to these consultations that are happening so that the quality can be monitored. complex system because it works at various tiers, but each level has a different kind of accountability. Technology is one part, but technology is only a part which the whole purpose of it is to leverage the human skills that are available there. Technology is a driver, but only to the extent that technology can be embedded in the environment where the program is implemented.
We also found out that the most effective feedback is from the newspapers. We have, in most newspapers, we have actually a column whereby patients or our clients put some short messages. They actually tell the government what their problems and how they want them to be addressed. So most of these problems are picked up by the managers, and most of the time the ministers of health actually go to parliament and discuss the problems, or go to cabinet and make sure that the cabinet knows what are the issues, and of course then we will be able to address them. He will also be able to advocate for more resources so that we'll be able to look at those resources we have and allocate them accordingly. The government has realized that actually the voice of the people counts. And now the government is really increasing a lot of resources towards healthcare system, which has really changed. Especially during this financial year, the health system has got a lot of money comparing with other years.